They can be embarrassing and also painful. I'm talking about the dreaded skincare issue, cold sores. Cold sore season is here, but you have the power to fight back. This morning, we're going to discuss a way to help you save face. Joining us with some great solutions is Dr. Heather Woolery-Lloyd, the Director of Ethnic Skincare at the University of Miami. Good morning.
Good morning.
Thank you so much for being here this morning.
Thank you for having me.
So let's talk about this, because when I was growing up, I'd hear cold sores, you're getting an infection, you might be getting a cold. Let's clear up the air here. What is a cold sore and what causes them to appear?
Well, cold sores are blister-like sores that can occur on the lip or face, and they're caused by a virus called the herpes simplex virus 1. And unlike the viruses that cause colds or flus, that virus stays in your body for life. So when you don't have any symptoms, it's called latent. But sometimes it becomes active, and that's when you see the cold sore.
And when you hear the word herpes, again, it can be an alarming word for some people, and yet sometimes you think to yourself, it really shouldn't be.
It shouldn't be. There's really no reason to be alarmed. In fact, up to 70% of adults in the United States have the herpes simplex virus. And of those, 15 to 40% experience symptoms or cold sores.
And who gets cold sores?
So it can occur in all ages, but it is more common in women, and it does increase as you get older, the risk of getting a cold sore. And basically, it's transmitted once you have direct contact with a herpes lesion in someone who has an active infection. So that's how you get the cold sore virus.
So why is it more prevalent in women? Why is it that it's always women?
Well, we really don't know that, actually, but it is more common in women. We do know that. And really, it's just a very common thing. And I really try to emphasize to my patients, it's nothing to be ashamed of.
Right.
It's quite common, and the vast majority of adults in the United States have the cold sore virus.
So what triggers a cold sore? Do we know?
Yes, there are many different triggers. It can be triggered by sunlight. It can be triggered by a cold or a flu, emotional stress.
Can it be seasonal also? Because sometimes I've heard the cold weather, really?
Absolutely. We do see it more during the winter months when we have more colds and flus. Everyone has their different triggers, and for me as a dermatologist, it can also be triggered by procedures. So if you're doing a laser procedure on the face or even oral surgery can trigger a cold sore.
And obviously stress, that's like number one.
Definitely, number one.
Now, how do you know you're going to get a cold sore? Are there symptoms? Is there something to watch out for?
There are symptoms. In fact, most people experience some type of tingling, stinging, burning, itching, and some people might experience a little mild pain. So there's a prodrome, we call that the prodrome, before the cold sore comes out, and that's the best time to start your treatment.
And that's probably the best time also to go see a doctor. And I know this for a fact that many people will either maybe put some makeup on, women of course,
yes,
and or maybe some cold presses, ice. Does that work?
Well, the cold presses might cause some temporary relief, but they're not going to shorten the duration of your cold sore. So it's more important, I think, to use a prescription cream because that's where you'll see the results.
So tell me one that you like that works for you.
Well, the treatment that I love in patients with cold sores is actually Denavir. This is what it looks like. And Denavir is pencyclovir 1% cream, and it can be applied during the prodrome period where you're having the tingling or the stinging sensation prior to the cold sore, and it can also be applied directly to the cold sore. And it's been proven to shorten the duration of the cold sore, and shortening that duration makes a big impact on someone's quality of life.
Now, I always ask in terms of side effects, are there any that one should be concerned about?
Yes, in the clinical trials, 3% of people who received the Denavir had local side effects, and actually 4% of people in the placebo group had local side effects.
Really?
Yes, and those local side effects could be skin sensitivity, a rash, or change in taste.
Now, in terms of cost also, you know, a lot of people sometimes say, I'd love to get it, but I can't afford it. How does this compare?
Well, for me, that's really important because sometimes prescription medications can be so expensive, but Denavir has a copay assistance program. So for eligible patients, they pay no more than $15.
Oh my gosh, so worth it. Thank you so much.
Thank you.
Do appreciate your time, doctor.
Thank
Come back
you.
with something for pimples?
Maybe next time.
That's what I need. All right. Remember to talk to your doctor to see if Denavir may be right for you. Or for more information on Denavir and how it can help you manage your cold sores, visit our website, thebalancingAct.com. That's thebalancingAct.com. We're also on Facebook.